Bone grafting and implant dentistry, building a foundation for success. When it comes to dental implants, bone grafting plays a crucial role in ensuring the long-term success of the procedure. Without an adequate amount of healthy bone tissue, the implant may not be able to properly integrate with the surrounding jawbone, leading to potential complications and implant failure. In this video, we will explore the importance of bone grafting and implant dentistry and how it helps to build a strong foundation for successful dental implant procedures. What is bone grafting? Bone grafting is a surgical procedure that involves taking bone tissue from one part of the body and transplanting it to another area where bone loss or damage has occurred. In the context of implant dentistry, bone grafting is often used to augment the jawbone to create a stable and secure foundation for dental implants. There are several types of bone grafting procedures that can be used in implant dentistry, including autografts, bone tissue taken from the patient's own body, such as the hip or chin. Allografts, bone tissue taken from a donor source, either human or animal. Xenografts, bone tissue taken from a non-human source, such as cow or pig. Synthetic bone grafts, bone-like materials that are specially designed to mimic the properties of real bone tissue. The choice of bone grafting material will depend on the specific needs of the patient, as well as the extent of bone loss in the jaw. Why is bone grafting necessary for dental implants? In order for a dental implant to be successful, it must have a solid foundation in the form of healthy, dense bone tissue. If a patient has experienced bone loss in the jaw due to factors such as tooth loss, gum disease, or trauma, they may not have enough bone to support a dental implant. Bone grafting helps to address this issue by adding new bone tissue to the affected area, creating a stable and secure foundation for the implant to be placed. This not only improves the chances of a successful implant procedure, but also helps to prevent complications such as implant failure, bone resorption, and sinus perforation. Bone grafting also helps to preserve the structure of the jawbone and prevent further bone loss over time. By maintaining the integrity of the bone tissue, bone grafting can help to support long-term dental health and improve the overall aesthetics of the smile. The bone grafting process. The bone grafting process typically begins with a thorough assessment of the patient's oral health and bone density. This may involve taking X-rays or CT scans to evaluate the extent of bone loss and determine the best approach for bone grafting. Once the treatment plan has been established, the actual bone grafting procedure can begin. This typically involves the following steps. Anesthesia. The patient will be given a local anesthetic to numb the area where the bone graft will be placed. Bone graft placement. The bone graft material will be carefully placed in the area of bone loss or damage, either as a block of bone tissue or in granular form. Healing. The bone graft will be allowed to integrate with the surrounding bone tissue over a period of several months. During this time, the patient will need to follow post-operative care instructions to ensure proper healing and integration of the graft. After the bone graft has fully healed and integrated with the surrounding bone tissue, the patient may be ready to undergo the dental implant placement procedure. This typically involves surgically placing a titanium implant into the jawbone, which will serve as the anchor for the replacement tooth or teeth. Potential risks and complications. Like any surgical procedure, bone grafting for dental implants carries some risks and potential complications. These may include infection at the graft site, rejection of the graft material, failure of the graft to integrate with the surrounding bone tissue, nerve damage or injury, sinus perforation in the case of grafting in the upper jaw. To minimize the risk of complications, it is important for patients to follow their dentist's recommendations for preoperative and postoperative care, as well as maintain good oral hygiene to promote healing and prevent infection. Conclusion. In conclusion, bone grafting plays a critical role in the success of dental implant procedures by providing a strong and stable foundation for the implant to be placed. By addressing bone loss and creating a supportive environment for the implant, bone grafting helps to improve the chances of a successful outcome and long-term implant success. If you are considering dental implants but have experienced bone loss in the jaw, it is important to consult with a qualified implant dentist to determine if bone grafting is necessary for your procedure. With the right treatment plan and proper care, you can build a solid foundation for a healthy and beautiful smile with dental implants.